Ashford and St Peter's Hospital's NHS Foundation Trust want to ensure that the patients in our hospitals are only those who will benefit from our care. This is because hospitals are best suited for treating those who are very unwell and need urgent and emergency care for serious and life-threatening symptoms. Spending a long time in hospital can increase the risk of you falling, catching another infection during your stay, or loss of mobility, which may result in you needing additional care when you leave the hospital. We want to provide our local population with the tools and knowledge they need to help them make informed decisions when they need to access healthcare services, so that they receive the right care, in the right place, at the right time. If you require health or care support, there are a range of services that can be accessed to offer you the right treatment. Usually, conditions that do not require urgent or emergency care can be safely managed at home with the help of our community services. We want to support our community to choose well when considering where to go when seeking medical help, so that they access the best service to treat their condition. When you experience symptoms such as minor cuts and grazes, a sore throat or cough and cold, you can usually manage and care for these safely at home. Your local pharmacist is there to help you find appropriate treatments to alleviate conditions such as headaches, upset stomachs, aches and pains, and bites and stings, which can be given at home. If these symptoms persist, you should make an appointment and speak with your GP, who will be able to ensure that you get the right support for your condition. Your GP will be able to prescribe medication to help treat symptoms, or make a referral to another service for further investigation or support. Walk-in centres and minor injury units can provide urgent but non-emergency care for a range of conditions, which includes cuts, sprains, rashes and minor burns. These services provide nurse-led medical care and do not require an appointment to access. If you or a loved one is experiencing a mental health crisis and need urgent help, the Mental Health Crisis Helpline is there to provide 24-hour support. The team are there to listen and support you and can also share information about other services that may be able to help. NHS 111 is there for you 24 hours a day, 7 days a week if you require urgent care out of hours or if you're unsure of where to go to get help. You can call NHS 111 or visit NHS 111 online to get help for your symptoms, find your nearest service and receive general health information and advice. If needed, NHS 111 can book you an appointment to be seen at your local A&E, urgent treatment centre, pharmacy or other appropriate service. You should call 999 or come to A&E if you need urgent and emergency care for serious or life-threatening symptoms, including severe bleeding, breathing difficulties, severe chest pain or loss of consciousness. In these situations, hospital is the best place for you to receive the care you need. You will be brought into hospital if our team consider this to be the best place to treat you and if you cannot be treated by your GP as an outpatient or receive virtual care. When you start your treatment in hospital, we will work with you and your family or caregiver to discuss your options for when you leave, so that there are clear expectations around when you can expect to leave and where you might continue your treatment or recovery. Once you have finished your treatment in hospital and it is safe for you to do so, we will make every effort to ensure that you are able to return home. If our team become aware of any social care or additional requirements that you may need for pre-existing conditions, they will ensure that you're referred for a social care assessment to an outpatient service or back to your GP when you leave the hospital. Sometimes this may not be possible. In these circumstances, we will work with you and your loved ones in partnership with other teams to make a decision about the best place for you to continue your treatment or recovery. This may mean that you will need to be transferred to a community hospital, care home or hospice, depending on the support you require. We want to ensure we give you the tools and knowledge to make informed decisions about your care so that you are seen as quickly as possible by the right service who can treat your condition at the right time, which will help us to ensure that there is enough space in hospital to treat those who are very unwell when they need it. This will also help to reduce your length of stay in hospital, reduce the risk of you picking up another infection during your stay, and most importantly, provide you with the best possible outcomes and experience.